Hello and welcome. Today I'll be discussing a topic called pneumonia. Sometimes you hear people say, cold entered me. This is beyond catching a cold. It's a serious condition that could lead to loss of lives if not addressed quickly. So in this video, I'll be addressing a number of topics. Number one, I'll be defining pneumonia, classification, the causes, risk factors, signs and symptoms, investigations, treatment, and prevention. So what's pneumonia? It simply means infection of the lung tissue. Infection of the lung tissue. Now, usually you define the respiratory tract into, or divide them into the upper respiratory tract and the lower respiratory tract. A number of times when people talk about catching a cold or flu, that's usually maybe just the upper respiratory tract. But when we're discussing pneumonia, this is involvement of the lower respiratory tract, that is involvement of the lungs. So what are the lungs? They are sponge-like structures where gas exchange occurs. Sponge-like structures where gas exchange occurs. Now from biology, we know about the fact that we take in oxygen and breathe out carbon dioxide. So the place where this exchange occurs is in the lungs, a place called the alveoli. At that point, you have the body giving away the waste product, which is carbon dioxide, and then taking in oxygen that you have inhaled. Therefore, any disease that results in damage to this structure called the alveoli or the lungs will definitely have consequential effect on the body. Therefore, if there's damage, it will impair oxygen absorption. We could classify this condition based on, number one, the type of organism causing it. Number two, it could also be classified based on where it is gotten and also the anatomy. So we'll start with the organisms causing. Typically, we talk about viruses, bacteria, and fungi. Bacteria are the most common causes of pneumonia. We could also classify it based on where it is gotten. So we talk about community-acquired pneumonia. This is pneumonia that occurs or that is contracted in the community where we live with people and somebody has an infective organism or pneumonia and then transfers it to somebody else. So that's community-acquired pneumonia. It could also be a hospital-acquired pneumonia. So sometimes the patient presents to the hospital, say the patient has a stroke, and whilst being treated for the stroke, within 48 hours develops signs and symptoms of pneumonia. When the patient came into the hospital, he or she did not have any pneumonia. But whilst in the hospital, there's exposure to various organisms in the hospital and so contracts pneumonia. And so we describe that as hospital-acquired pneumonia. And just a quick one here. Sometimes when a patient presents to the hospital and is being treated, situations arise where the doctor feels that you are stable enough to go home. Now, as a patient, don't always think that the doctor wants to get rid of me or to get me out of the hospital as quickly as possible. No, sometimes it's actually in your best interest to go home and recuperate rather than remain in the hospital because you may be exposed to other organisms rather than the primary condition while you came to the hospital. Number three, a subset of the hospital-acquired pneumonia is called ventilator-associated pneumonia. This will occur in patients that have been put on a ventilator, and for some reasons, they could also contract infections from that procedure. And then aspiration pneumonia. For patients that have, say, stroke, that may have an impairment in the cough reflex. Now, sometimes when we're eating, remember, you could have a situation where you almost choke and quickly you're able to make that response to bring out what almost choked you. That's the cough reflex. For some reasons, patients that have an impairment in the cough reflex, rather than being able to do that, that particular food or debit of foreign body goes directly into the respiratory tract and may become a nidus for infection. So we've looked at classification based on organism, based on where it is acquired, and then based on the anatomy. If you have the infection spread across the lungs, we refer to that as bronchopneumonia. If it is localized to just one lobe, that becomes lobar pneumonia. So what are the risk factors Well, technically, everyone is at risk because remember, we said that this could be acquired even in the community. But we do have protective mechanisms such that we are, though exposed, but not necessarily all developing pneumonia. And such mechanisms, number one, the cough reflex. Number two, mucociliary clearance, where within the tract, there are areas that have what's called cilia that helps to move away this debris so that you are then able to cough them out. And then we also have the soldiers of the body referred to as the white blood cells. These white blood cells are the agents that fight off, ward off invasive organisms and so protect us from diseases. There are other risk factors, age. For those that are particularly very young and those that are elderly, they are at risk because their immunity will not be as potent as it was or as it is for people that are young. Comorbidities. For patients that have, say, diabetes mellitus, they also are at risk of developing infective organisms or pneumonia. And then, if you are immunocompromised, such patients have either malignancies or retroviral disease as HIV, they're already in a state of being immunocompromised, and so they're exposed to these organisms and can become infected. People that are immunosuppressed. Now, for some reasons, if you have a condition for which you require very potent medications, say for a patient that has malignancy or a rheumatological condition, they may be placed on immunosuppressants to handle the condition. But by so doing, they are then predisposed to developing or getting these infections or becoming having pneumonia. The unvaccinated, for patients that have not been vaccinated, they may also be exposed to certain organisms and develop pneumonia. What are the symptoms? Number one, shortness of breath. Number two, pleuritic chest pain. What does that mean? Around the lungs, there is a lining around the lungs called the pleural membrane. There is an immediate lining just around the lungs called the visceral membrane. That visceral membrane has no nerve endings because it just overlines the lungs. And then there is the parietal membrane that also overlines that one. And so you have the visceral membrane and the parietal membrane. Usually when you take in deep breaths, in and out, you don't feel any pain. However, when patients develop these conditions, because of the inflammation that occurs there, you could have a small amount of fluid in the pleural space. And so when you take in a deep breath, you feel a sharp pain at the sides. We refer to that as pleurisy. So inflammation of the pleural membrane can present with chest pain. Patients that have pneumonia may also have cough. Usually this cough will be productive of sputum. Now the sputum may have different colors from white to brownish to greenish, and these perhaps I may do a video concerning the various types of sputum. And if you think that is something you'd be interested in, you can leave a comment in the comment section, and then I would possibly do a video on that. Patients may also cough up blood. The situation we refer to as hemoptysis. I'm sure you're beginning to see that pneumonia is not just simply cold entering your body. It's a more serious issue that needs to be addressed urgently. Patients may also have fatigue. Remember, we said that the lungs are the areas of gaseous exchange. If you have a situation where the oxygen that's supposed to come into the body can't come in, it therefore means that you will be predisposed to being very tired because you need the oxygen to go around the body for you to have energy. Fever, poor appetite, headache, these are some of the symptoms that may be associated with patients that have pneumonia. Also, you could have a situation where we talk about the signs of pneumonia. For patients developing these symptoms, symptoms are simply what a patient presents with. Signs are what the doctor finds out on examination. And so when the doctor examines a patient that has pneumonia, what does he see? He sees a patient that is breathing fast. In other words, your respiratory rate increases. We call that tachypnea. You develop a fever. We call that hyperthermia. You develop an increase in the pulse rate. We call that tachycardia. There's dullness to percussion. Well, these next terms I'm going to use now, we could leave that for the medical students or the doctors. Increase in tactile vocal fermentals, dullness to percussion, increase in vocal resonance, crepitations when he listens with the stethoscope, and bronchial breath sounds. The typical breath sounds that we have are referred to as vesicular breath sounds. But when you develop pneumonia, when the doctor listens with the stethoscope, he hears a certain kind of sound referred to as bronchial breath sounds. What are the investigations a doctor carries out? I'll put this into two categories. Number one, the blood investigations. Number two, x-rays. Now, for the blood investigations, the specific aspects that is being looked at is the white cell count. For patients that have an infection, remember I said that usually this could be caused by infection, the white cell count will be raised. And an x-ray can be done. When an x-ray is done, it may show patchy areas across or through the lungs, referred to as bronchopneumonia, remember that term. And then sometimes when an x-ray is done, it will show consolidation in a single lobe, what we refer to as lobar pneumonia. So how is the patient treated? The treatment will of course depend on the cause. Remember we said that this could be viral, this could be bacteria, this could be fungi. So depending on the cause, the doctor will treat. But being that bacteria organisms are most likely responsible, you're most likely to have antibiotics. Are you going to have oral antibiotics or intravenous antibiotics? This also depending on the severity of the condition. If it's very severe, an admission will be required to resolve this condition. And because of the chest pain that occurs because of the affectation of the pleural membrane, you will require analgesics to relieve the pain. How can this condition be prevented? I say don't give and don't take. What does that mean? We've said that this could be acquired in the community. And so if you know that you're having an infection or think or suspect that this could be an infective problem, you may need to wear a mask to prevent spreading it to others. And if you are going into an environment where you know that you have comorbidities such as diabetes, you're on immunosuppressants, you know that for some reason your immunity is compromised, you may be careful about where you go to and may need to wear a mask as necessary. And then number two, the need for vaccinations. For patients that are, say, above 65 or between 2 and 64 that have certain health conditions, they may be eligible for certain types of vaccinations such as pneumococcal vaccine to prevent pneumonia from occurring. I hope you've learned something. You may want to like and share and subscribe. Thank you and see you again.